finished with the, yeah, okay.
Okay, with Anne, perfect. Okay.
Yes.
All right, so I'm just going to go briefly explain the healthcare program and basically prerequisites, kind of what the program looks like, the cost, and then if you have any questions, you can just stick it in the chat there. So healthcare program is basically part of the medical program, and your educational journey is about to start. So there's a picture of, you know, what you may be doing in the online or in the in-person labs, looking at the heart. So healthcare's mission and vision, basically our health programs provide health education based on best practice, graduate safe, caring, and competent professionals. And our vision is that we become a first choice online health education provider, meeting health system and workforce needs. So do you care about helping others? This accessible and flexible program prepares you to become a vital member of the healthcare team. They'll provide care to all clients, clients of all ages, so ranging from infants up until the elderly, the geriatric population. Acute care, so that would be the hospital setting, continuing care, long-term care, home care, where you go into people's homes and provide them with assistance, and certain possibly group home settings as well. Once you complete the program at college, there's a provincial standard exam. So you write an exam at the very end that registers you with the Healthcare Aide directory. So you would complete that once you finish the program at Northern Lakes College. So the prerequisites to getting into the program. So what you need is to have English 20-2, so that's grade 11 English, 60% or equivalent. So 60% or higher. So that's really the only prerequisite academic requirement. We do require immunizations and, of course, a police information check, because you are working with vulnerable people. We do need to have your police information check. We do recommend AF 20 as well. But it is not necessarily, it's just recommended. It will help with, healthcare aides do medications. Now they don't do the calculations, but they do provide medications to their clients. If you don't have English, that level of English, say English is your second language, maybe you didn't get that when you were in high school, you got 20-3 instead of 20-2, you could write an assessment exam, which is called the AccuPlacer. So it sees what level of English you're at. So you can do that instead of the English requirement and see if you meet the equivalency that way. So of course, everyone wants to know the cost. This is the cost for 2021-2022. So it is $26.35 per semester. So for a total of $52.70 for the program is 10 months, which I will get to on the next slide. There is some travel involved depending where you live. So if you live in Slave Lake, the travel is minimal because we do utilize that campus and that clinical setting. If you live in Grand Prairie, unfortunately, there is some travel involved with part of it, just depending on what area of the province you live in. That cost will vary for you. So the healthcare program, it starts in September and it ends in June. So 38 weeks is the program length. There is a break at Easter. There's a break over the holidays, over Christmas. Get a 2 to 3 week break there as well. So the course is delivered online Tuesday, Wednesday, Thursday afternoon. So basically just like this setting that I'm in right now is how the class is delivered. The classes are recorded, so if you are unable to attend a lecture, you have access to the recording later in that day, next day in the evening. Face-to-face labs, so the instructor, you'll travel to one of our sites and the instructor will provide face-to-face instruction. So basically you'll do the hands-on portion. That's where you learn, the skills involved, like running the lifts, bathing, all of the skills that are involved in caring for your clients. And then we have clinical pieces. So the instructor will take you into primarily long-term care settings, and you will work with the instructor and provide care doing the skills that you've learned in the lab. So you'll work with the instructor and the healthcare aides and LPNs or RNs that are on staff there, and you will do the skills in the clinical setting. So this year we used Slave Lake, Peace River, and High Prairie for our lab sites. And our clinical sites, we are using High Prairie, Slave Lake, Peace River, and our Grand Prairie. So that, of course, is subject to change depending on student numbers. And for example, High Prairie, we're not running a clinical site this year, but we have most of the previous years. For some students or potential students who are already working as an uncertified healthcare aide, there is our other program that we provide is the estep program. So that's if you're working as an uncertified healthcare aide, you can take the program self-study and you use your on-the-job hours towards your clinical. So your clinical hours, 320 hours that you need for clinical hours, you can actually use your hours as an employee to meet that requirement. And then you work through the program, the exact same curriculum as the full-time program at your own pace as you guide yourself. You have 1 year to complete that. So there's kind of two options that you have that we provide at Northern Lakes College. So Alexis, did you put your name in for the draw? Make sure that there's a draw for, well, make sure you do that. And if you apply to any program today, I'm sure maybe your aunt told you the program application fee is waived today, so you don't have to pay for application, which is really, really nice. Yeah, so that is basically, a fairly condensed version of, obviously there's a little more involved, but that gives a good idea of what the expectation is if you were wondering what the program was. It's changed. It used to be a 20-week program, and in 2019 it went to basically double the length, just added some stuff because healthcare aides are working in a much larger capacity now. They're doing acute care and they're just working at in a broader spectrum, so that program had certain information added to it. Do you have any questions, Alexis? Or if you do, I know you don't have a microphone, you can just type them. And if you don't, or if you think of something later, you can always contact me too. I guess I should have introduced myself. My name's Jennifer. I'm the coordinator of the program. Donna Shoemaker, the instructor, she's the full-time instructor. And at the present time, we're the two full-time employees in the healthcare program at Northern Lakes College. Rhonda, did you have anything that you wanted to add?
I was just, well, hello, I'm Rhonda. I'm the chair for the nursing programs, the PN and the healthcare aide program. And as Jan mentioned in there, it's a program, the estep program is quite an interesting venture if you choose to get into it. It's easily accessible. To let you know too that healthcare aides now work in hospitals, they work in clinics, nursing homes and any aged care facilities. So the role is expanded quite a bit, and you can actually work in, I've seen healthcare aides work in like the ICUs, emerge departments, and like Jen, I'll just echo what Jen said, the role is expanded exponentially. Actually, it's expanding like the other healthcare aid programs. Are there any other questions? Or if you get any, just put it in the chat box, and Jen or myself will answer it the best way that we can. And I'm actually going to put my email address in here for anybody that wants to email with any questions regarding the program. And you can feel free to do that as well. And Jen, I don't know if you would want to put yours in there.
Yes, the program is from September to June. Most of our students are done usually about the beginning of June, because they do have they finish about the beginning of June, first week of June, and then you have the 60 days to write the registration exam through the Alberta Health Directory after that. So they'll have 60 days usually through the summer where you're able to write that exam. So the practical nurse program is
that's
2
for
years
the full-time.
Yeah, currently, and the full-time program for healthcare aid is
You there?
Alexis, if you have any other questions, feel free to reach out to one of us at our email address, or ask Jeannie. She can hook you up with one of us, and we can answer any of your questions. I know things come up, and then, oh, I should have asked that, or maybe not. Maybe it was covered. But yeah, so reach out to one of us if you do have questions, or somebody who might be interested in the program, or isn't sure what it's about. So spread the word. Well, thank you so much for, oh, sorry, go ahead, Rhonda.
No, I just wanted to add, Jen, that this is actually being recorded, and you can view it at any time that you want after tonight. It's going to be posted on the website, so if you're uncertain about, I know, Alexis, you said you just took a picture of the emails, but you can see it again, just view even and listen to our conversation.
All right, well, thanks, Alexis. If you don't have any questions, that basically, we'll kind of finish off the presentation about the program, and I look forward to hearing from you, or, if you just do decide to, apply to any of the programs. Like I said, tonight is a good time to do it, so that you get that application fee waived and can save some money, so you can put some gas in your car. So, anyway, thanks so much for your time. Thanks, Rhonda, for joining.
Yes, thank you, Jen.
Yeah, take care, Alexis. You have a good night too.
Yeah, bye.